This is Susan, and thank you for listening to my presentation on the integration and big picture related to eating disorders. So for this, we're going to be looking at how eating disorders are related to osteoporosis, irritable bowel syndrome, and type 1 diabetes. So in regards to osteoporosis, you'll recall from our class lectures and text, osteoporosis is a disease resulting from a decreased amount of bone mineral and organic matrix, which weakens bones and it makes them more susceptible to fractures. Bone turnover has been shown to be influenced by several factors, including estrogen deficiency, glucocorticoid excess, malnutrition, and reduced body mass. So as you can see, these are all factors that would be related to someone with an eating disorder. So thus, osteoporosis is a very common complication in those with anorexia, and it can be seen with those with bulimia as well. And as you remember from our class lectures, peak bone mass is reached by the end of the second decade in healthy individuals. Anorexia often begins in those early teen years, and so oftentimes peak bone mass is never reached for these individuals. This is due to A, they're not receiving enough critical nutrients such as calcium, magnesium, phosphorus, and B, if there's prolonged amenorrhea or lack of menstruation, that places them at a higher risk due to the lower estrogen levels. So there's some controversy over how bone resorption is impacted by eating disorders. Some authors have reported high resorption rates and normal to low bone formation rates, whereas others have found no change in bone metabolism. So it's a little confusing, but from my research, it appears that it definitely does affect it. There's certain factors that make it more likely, such as a lower body weight and the binging and purging, which we'll get to in a moment. So it's been found that the uncoupling of bone formation and resorption is likely to cause a net loss of bone mass. The subgroup of anorexia, as I just mentioned, those with binge eating, purging type, show the highest rate of bone resorption and are at an increased risk of developing osteoporosis with the worst outcome regarding bone status, regardless of initial bone mass, weight history, and duration of illness. So even when those individuals in the subgroup who recover and resume their menstruation, they still have comparably low estrogen, follicle-stimulating hormone, and luteinizing hormone. And so this is a pretty important finding, as it explains the reduced state of bone formation in this particular group. And on the other hand, those with bulimia and normal body weight, they are the least risk for bone loss. So this lets one conclude that the eating and purging behaviors in those with anorexia are much more detrimental because they're at a lower body weight in general than those who are binging and purging at normal body weights. So moving on. For irritable bowel syndrome, as you remember from our class lectures, it's a disorder characterized by abdominal pain with diarrhea and constipation. The etiology of of IBS is unknown, but factors such as genetic predisposition, altered immune response due to food sensitivities, and altered gut microbiome, small intestinal bacterial overgrowth or SIBO, impaired gut-brain axis signaling, increased sensitivity of the enteric nervous system are all considered factors involved in the development of IBS. Stress and history of sexual abuse are considered to increase sensitivity of the gastrointestinal stimulation and is considered to exacerbate symptoms of IBS. So there's a strong association between sexual abuse, eating disorders, and IBS. They've found a high incidence of IBS in outpatient bulimics and those diagnosed with eating disorders not otherwise specified. There's a study where 64% of outpatient group currently met the criteria of IBS. 64% of those who had been diagnosed as bulimic met the criteria for IBS. The majority of those, 87%, had developed their eating disorder before the onset of IBS, with a mean of 10 years between the onset of eating disorders and IBS. So that would mean IBS would definitely be more considered a consequence of the eating disorder versus a cause. Another study that was mentioned by De Jong and his colleagues said that 98% of those in a sample of patients with eating disorders met the criteria for functional gastrointestinal disorder, with IBS being the most prevalent. Anxiety has been considered a predictor of IBS, which is also a common trait in those with eating disorders, as we've mentioned earlier. So the relationship or the exact mechanisms involved in how IBS and ED occur or coexist hasn't been formulated as of yet. But based on the data that I've collected, my speculation would be, or my hypothesis would be that it's an altered gut microbiome, genetic stress, and environmental triggers all working together that create this coexistence of IBS and eating disorders, because there's many similarities in the onset of eating disorders and irritable bowel syndrome. So it would make sense that there would be a commonality between the two. Okay. So also type 1 diabetes is yet another, in this case, disease that's commonly co-occurs with eating disorders. And as a reminder, a type 1 diabetes is an autoimmune disease where insulin-producing beta cells from the pancreas are destroyed by cytotoxic T cells or autoantibodies. As much as you know, having a type 1 diabetes requires a lot of work. So the goals are pretty intense. It's very rigid as far as food portions, monitoring blood sugar, weight, exercise. And that rigidity is very similar to the rigidity found in those with eating disorders. And it can be a triggering factor for those who are prone to eating disorders. Type 1 diabetes can raise a person's risk for depression and anxiety. And as we've said earlier, eating disorders often overlap with anxiety and depression. So again, there's this interrelated relationship between these diseases. Most of them don't occur in isolation. So they also found women with type 1 diabetes to often purposefully engage in insulin restriction. So they call it intentional insulin restriction as a means to lose weight. And the excess, so what happens with this is the excess glucose is flushed in urine as the body is deprived of insulin, and the body breaks down fat as energy. And this is a very scary way for a type 1 diabetic to lose weight. This is a new concept to me. I didn't realize that women with type 1 diabetes were doing this, but as one can imagine, this puts them at a very high risk for diabetic ketoacidosis, infections, nerve damage, eye damage, osteoporosis, and many other ailments that are common with eating disorders and type 1 diabetes. So if any of you know clients in the future who are type 1 diabetics and have some type of weight issues, this is something definitely to be aware of. So again, gut microbiome is this main key player that comes up in almost every one of my points here. But it also, because of the fact it plays it's an important regulator of the immune system, and its alterations have been associated with type 1 diabetes and with the development of eating disorders, it can, there can be a definite link between eating disorders and type 1 diabetes just based on gut microbiome alone. And then, of course, hypoglycemic episodes are common with type 1 diabetics, where there's intense hunger and there's a dysregulation of gastrointestinal hormones, which leads to binge eating and possibly purging. And if this happens on a regular basis, you're going to have a manifestation of an eating disorder. So, moving on here to the big picture. As I've said many times, eating disorders are multifactorial. And so it would seem that this is definitely a way that the body is adapting to stress. For those who have experienced trauma, such as sexual abuse or some kind of like PTSD from war, an eating disorder is a way of giving one a sense of control. With the combination of stress, environmental triggers, genetics, altered microbiota, this creates the perfect storm for one to gain this pseudo sense of control by either restricting or over-consuming food. Fetisov, he talks about the mechanisms involved in the homeostasis of energy and emotions participate in stress adaptation. But when this mechanism is altered by pathogenic gut microflora, then eating disorders can develop. My belief is that the body chooses to undergo these mechanisms and react to stress or bacterial invasion with the desire to engage in eating disorder behaviors as an alarm system. It's a big bell saying, hey, there's an imbalance right now and it needs to be attended to. So if someone's strongly driven to undereat or overeat, this signifies to the individual that there's something that needs to be addressed physiologically. And of course, this would mean the person needs to be more mindful and discerning of their behaviors, and this often would require some type of a treatment. So in conclusion, the fact that eating disorders are multifactorial, as I've mentioned throughout this project, is indicative that there's always underlying reasons our bodies gravitate towards self-destructive behaviors, and it's of importance that we listen to the wisdom of our bodies and seek balance as necessary. So thank you for listening, and please be well.